Okay, good evening. It is Tim Ashe. It is Tuesday, April 21st. Thanks for joining me for my nightly update on Vermont's response to the COVID-19 pandemic. Tonight, I'm going to primarily spend my time highlighting the work of a number of people who are working in the mental health field, working with vulnerable populations, people with developmental disabilities, and others, because I feel like one of the things that is rightfully acknowledged during this crisis is the people who are working on the front lines of physical health, people in hospitals, health clinics, and so on, and the work they're doing and the risk they're putting themselves in. It's obviously the work they're doing is amazingly important, and the risk they're putting themselves in makes us think of them even more right now in the sacrifice they're making. Mental health, which many of us believe should be considered on equal footing in general when we think about people's well-being alongside physical health, doesn't always get the same focus in our minds, in part because mental health has been the focus of so much stigma, or the victim of so much stigma over the years. And so I'm going to spend a considerable amount of tonight's program talking about people who are working to support people through their mental health challenges, people who have developmental disabilities, and throughout the state. And of course, while I'll single out some people, many of them have coworkers throughout their organization and peers throughout the state who are also doing things that I won't mention tonight, all of whom deserve tremendous amount of recognition. But in the time I have, I'll do my best to explain some of the work that's been going on that you probably don't see in front of you, because it's not the stuff of newspaper pictures, because much of the work is done privately and confidentially. We don't really see the images of it, even though, especially with all the stress and uncertainty of this crisis, it's really, really important. Before I turn to that, though, earlier today I went for a jog. Every day I'm trying to get a little bit of exercise just to get the the bad energy out and stay as healthy as possible. And the word that I keep thinking of when I'm outside and I see so few people out on the front lawns, I don't see people congregating the way they normally would, is melancholy. It's this feeling that it looks kind of the same as normal, but the thing that's missing is all the people. And I think we're all, 6 weeks almost into this COVID-19 state of emergency, stay-at-home order, and it starts to weigh down on you. And, as I was jogging, and maybe it's because I was dehydrated or something, and I start having, my mind starts going into different places. But, I was thinking about, some of the highlights for me in my high school experience. And, while I was a total bookworm, I also was I was a devoted soccer and baseball player. I wish I had been better at both. But that is what it is. I wasn't blessed with all the gifts I wished athletically, but was fortunate to play both sports in high school. And, I was thinking about how 25 years ago, that's literally 25 years ago, in 1995 was my senior year of high school. I'm not sure if I should reveal that to the world, but it was. And literally this week, 25 years ago, was my senior year of baseball, which produced some of my best memories. I actually had some of the old newspaper clippings, and this one's from the Milford Daily News. This was the Tuesday of this week of April in 1995. And I have to say, I did not select this on purpose, but in this one, I pitched that game. I was the starting pitcher and pitched a 4-hit complete game, 2-1 victory. Trust me, there were losses that season, and I was the pitcher for a bunch of them. The next day, we played a team from Cape Cod and had to travel down to Harwich, and was able to pitch 2 innings there to get the save in that game. I didn't throw very hard, but I had a bit of a rubber arm, so I could pitch basically every day. And I don't mention those to reminisce about my youth, but really to reflect that all the high school seniors right now are missing a lot of those opportunities that we had, that many of us took for granted. And so, whether it's theater productions, sports teams, academic clubs, all the things that students try to cram into that final year of high school for those who are seniors. Obviously, they're missing those things predominantly. Very few can be done using Zoom or Facebook Live or anything like that. So, it's one of the reasons why I feel so strongly that I don't know how we'll pull it off, but I am really insistent that every single high school senior have the chance to have an in-person graduation ceremony. I don't know if that will be Thanksgiving weekend. I don't know if it'll be during the winter holiday break. I don't really care about that, but I do think that every high school in Vermont should telegraph immediately that there will be an in-person graduation ceremony so that everyone has the chance to have that milestone in their life. It won't make up for all the things that people are missing out on, but I do think that it'll go a little bit of distance to giving people some, closure of what would otherwise be a really critical time in someone's development as they set out as adults into the world in whatever they're going to do next. So I'll be working with our Senate Education Committee, our counterparts in the House, reaching out to the Vermont Principals Association, the Superintendents Association, to make sure not just that it's done, but that be communicated to students and their parents now, that there will be a plan, even if we don't know when it will be now, to make sure that those in-person graduation ceremonies happen. I don't dare say that we could reenact the high school season and I could help go out and pitch. My arm is shot. So I'll leave it at that. But there are a number of other things that people are missing out on that are really, really critical at any stage of their lives. But just thinking, today I ran by on North Ave in Burlington, the high school baseball field, which of course is sitting there empty. So that was fresh on my mind. So now I'm going to turn to a series of vignettes, for lack of a better term, of people who are working in the mental health field throughout the state and providing really important services. I will just repeat for emphasis that at this particular moment in time, with all of the anxiety and stress, uncertainty in people's lives, you can only imagine that the normally difficult work and important work is just even more heightened than under normal circumstances. So it's going to be a bit of a journey throughout the state of Vermont. I hope you will enjoy hearing about what many of your fellow Vermonters are doing. And of course, the caveat is that while I will mention some people by name, there are many others who I will not mention by name, but who are certainly equally deserving. So I'm going to start with Upper Valley Services. I think it goes without saying they're in the Upper Valley, in the sort of central eastern part of Vermont. They're an organization that supports about 300 people with intellectual or developmental disabilities, as well as some elders who are otherwise eligible for nursing home care. They have a team that put together a response plan for the type of crisis that we're in right now. Don Kieran and Michelle Dindo from Randolph, who are part of the Randolph office, Dennis Gray and Lindsay Hennessy from their Moortown program, Marie Zura from their Comforts of Home program, and Jessalyn Gustin, Jessica Bellier, and Valerie Morse from their Bradford program. All of these people are coordinating and meeting every day to make sure that they have plans to meet the needs of all of the people that they serve, depending on the particular situation. Upper Valley Services operates in a fairly rural part of the state, and so that kind of coordination, which sometimes you take for granted, you hear about coordinating and team meetings at this time and in that region of the state, absolutely vital to meeting people's needs. Counseling Services of Addison County. I don't think I have to tell you which county that's in and where it is. It's the Middlebury area. Human Resource Director Alexa Euler and her staff have been having to deal with the massive complexity of all the federal and state laws, which they're having to synthesize and then communicate back out to the people providing direct services. They've had to respond also to the anxieties and worries of their own staff, who are human just like everybody else and having to go through this pandemic. Alexa has been described as steady, calm, compassionate, and working very long hours to keep the community mental health services going and serving some of the most vulnerable Addison County community members. So thanks, Alexa. Champlain Community Services, some people know this as CCS. They have a COVID-19 task force making sure that people with intellectual disabilities and autism in the northern part of Vermont are safe and supported and connected. And ironically, as they put it, they've been making sure that people are isolated, even though their normal work is to try to make people feel connected, but they need them to be physically isolated so that they're safe. Brent Huey, Karen Sichanovich, Nurse Lori O'Hanlon, Michelle Paya, Lee Studley, Jennifer Walcott, Mike Riley, and Beth Seitler have made a great team, making sure the staff, as well as the people they serve, are safe, healthy, connected, and paid, which is an important thing. These organizations already do not make much money, so this is a pitch to donate to them in crisis and out of crisis to support the work that they do. Howard Center, which of course is a very large, probably the largest provider of mental health services in the state. Leadership there say many people have stepped up, but Kathleen Buscaglia, Matt McNeil, Tanya Mason, Ann Paradiso, Delina Norton, and Dina Ryerson became the redeployment team, making sure that their 23 residential programs and other client-facing teams, meaning groups that have to interact directly with people even during this crisis, have sufficient staff to meet their client needs. Many people at these organizations had to self-isolate or quarantine because either they suspected or did come in contact with someone who was infected with COVID-19. So the fact that they were keeping all of the residential programs staffed was a Herculean task, one that we shouldn't take for granted. Lincoln Street is a specialized services agency that serves people with intellectual disabilities and autism in Windham and Windsor counties. They are doing as much face-to-face services remotely as possible and have had to be really creative. Their service coordinators are delivering supplies as needed. They've operated a warm line for all people that they serve, in addition to their normal crisis system, and they've had to secure personal protective equipment and coordinate backup plans and all of that stuff. The home providers and families that are part of Lincoln Street's community have been doing the brunt of the day-to-day care while everyone else is being as supportive as possible. Special recognition to the service coordinator, Lauren Ramsey, who's volunteered to stay in the hospital, providing supports for people who require emergency surgery. So an amazing kind of stepping up beyond the normal call of duty. Kristen Briggs at the Clara Martin Center has been the acute care coordinator, has been coordinating emergency services, preparedness, oversight of a residential facility. She's worked with Vermont Law School, Gifford Hospital, and all the local and state police to ensure that all the services for their clients are connected and coordinated. Described as having a can-do spirit, attention to the needs of clients and communities, and apparently is just the subject of a tremendous amount of commendation and appreciation. Elliot Montrone in the Clara Martin Center Help Desk team of Michelle Booten, Deb Holly, and Robin Wheeler, behind the scenes doing IT, have helped enable Clara Martin Center to continue moving services forward during the pandemic with all the necessary back-end support, which of course often also goes unnoticed because it's not direct care, but the direct care wouldn't be possible without it. So thanks to that crew. At Rutland Mental Health Services, Michelle Michalkovic, Director of Emergency Services, has her team providing remote, secure crisis assessments without needing to be at the Rutland Regional Medical Center Emergency Department. Doug Norford, who's the Director of Child and Family Services, has deployed his teams remotely to provide clinical support to children and families using telehealth during this crisis. Karen Grimm, Heather Hildebrandt, and Mary Graham McDowell of the school-based team are using mobile technology to ensure that students throughout Rutland County are receiving essential in-school mental health and behavioral support services, even though school's out. So just like many teachers, the mental health professionals who work in schools have had to also shift gears almost overnight to continue to meet people's needs. Cinda Donton, who's an elder care clinician, is remaining in close contact with many of the homebound elders that Rutland Mental Health Services serves, who receive mental health services from them. Also really important. Many of the oldest, most vulnerable Vermonters may not be as adept with technology, so it's really critical that people figure out solutions that will work for each group, each person served. Washington County Mental Health Services COVID-19 response team has been making sure they have continuity of care and providing support and treatment for all the people in central Vermont. A redeployment strategy implemented by Quality Assurance Director Jeff Rothenberg and HR Director Susan Lloyd, along with the senior management team, has been an integral part of the whole effort. Staff from the Sunrise Recovery Program delivered food and toiletries to isolated clients they serve. In addition, they also provided care packages, art supplies, jigsaw puzzles, all the things that would help alleviate the stress and bring people a little bit of relief over the course of their day to almost 50 people. Days later, they prepared about 200 care packages and also some basic medical supplies to go out to people as well. The agency's Children, Youth, and Family Services Choice Academy is delivering 260 meals per day to students at home, which has been managed by Devin Carter, who's the food services coordinator. So thank you, Devin. The Center for Counseling and Psychological Service is providing support to the Montpelier Econo Lodge and Hilltop Inn in Barre, which are now sites that are sheltering homeless Vermonters, with wellness groups, a co-occurring support group, and some one-on-one counseling. And so another instance of Vermont ingenuity and flexibility. So thanks to the Center for Counseling and Psychological Service. The psychiatric services, who are under the direction of Medical Director Jessica O'Neill, continue to provide services via teletherapy with their patients. Kathy Perry from the Community Support Programs has created 100 protective masks to help keep staff and clients safe. Another flexible use of staff resources to make sure people are safe. John Caceres, who's the Communications and Development Director, has developed a landing page, effectively the first thing you see when you go to their website, offering community insights on self-care, wellness, distance learning and education, and some sort of not upbeat, but anecdotes telling stories about people coming together to successfully address human needs during this crisis, which of course helps lift people up and give them hope that they're going to get the support they need. So thanks, John. HCRS, which is it's a mental health and substance treatment organization serving southeastern Vermont. I have to mentally remember where on the map, largely out of the Brattleboro area and the Springfield area. The direct service professionals in their developmental services division have displayed thoughtfulness, courage, creativity, and flexibility during the pandemic to meet their clients' needs. They deserve special accolades for being willing and eager to support essential face-to-face services to provide and preserve clients' home and emotional stability. And those folks who are doing the direct in-person work, Amy Baker, Clara Bridges, Sharon Bruce, Karen Chandler, Kalila Cliche, I'm sorry if I got that wrong, Nate Haskell, Lloyd McKenzie, Charlie Tripp, DJ White, and Tracy Jackson. So thank you for that amazing work you're doing. Becca Brown, the RN nurse manager and infection control officer. Infection control officers, by the way, should now get premium pay in normal times. I think we have a new appreciation for that. Has led the nonprofit group's efforts around managing the distribution of protective equipment, developing infection control protocols, advising staff on how to manage the illness, ensuring everyone in their 24/7 residential facilities stay healthy and safe. And Becca apparently has done this with great thoughtfulness and bravery, as her coworkers describe it. Ann Bilodeau, the Chief Human Resource Officer, has done apparently a remarkable job leading the agency's emergency preparedness response team. Passion, competence, creativity, and tireless enthusiasm in coordinating the effort has made a huge difference for the lives of the 600 staff. So these organizations that are providing services, just to put it in perspective, are staffed by large numbers of people who have made serving others their life's work. Ensured ongoing supports for the community. So thanks, Anne. And finally, Adult Services Division Director Kate Lamphere, also at HCRS, has led the effort to make sure the mental health and substance needs of residents in Windsor and Windham counties are being met, including getting the first crisis team in the state up and running with telemedicine in order to conduct remote mental health evaluations for the 5 hospitals that are in their service area. People sometimes forget that there's a whole number of small hospitals: Brattleboro, Springfield, Mount Ascutney, Grace Cottage, and I'm sure I'm spacing on the 5th one, Brattleboro Retreat, also a hospital in their service area. Kate has been described as being instrumental in staffing critical outreach teams and developing a warm line that supports community 7 days a week. Warm lines are a place that people can call and actually get a person when they need it, rather than just being pointed to some website or pamphlet encouraging people to seek wellness. So thank you, Kate, for all of your work. So that clearly gives some sense of the breadth of amazing work being done throughout the state. I could have surely mentioned 1,000 other people working in mental health, and not all work for the nonprofit organizations. There are private providers who are doing really critical work, serving people of all income levels and all levels of mental health challenges. All of that work has been made more stressful as a result of this pandemic. Many therapists I know report that people are wanting more sessions. Those sessions are more intense as a result of everything going on around us. And so we really owe a big debt of gratitude to all of those who've stepped up in their normal jobs, but to do extraordinary effort. So with that, I'm going to sign off for the night. I really want to thank all those who I mentioned tonight and those who I didn't, but who are in the same field. It sometimes, now that we're in week 6, it seems like easy to just start counting down the days to life going back to normal. But we have to remember, but this is the 6th cumulative week of extra stress on all the people I just mentioned and the crews that they work with. So thank you to them. Tomorrow, I'm going to have a special guest. The first time I've had a guest, I'm going to be doing like a Zoom thing that will transpose onto Facebook Live at the same time. I'll be having Governor Scott with me for a casual conversation, a chance for me to ask him some questions so that you can hear what's been going on in his thought process throughout this process from the very beginning. So I hope you'll tune in. He's been very gracious to agree to join me for that discussion. So we'll be same time at 5:30. It'll look a little different because it's going to be patched over from Zoom, but set aside the technical change, and I look forward to seeing you then. Good night.